Hello, this is Monthly Lab Student 22, and today I am talking about the use of neuroleptics, also known as antipsychotics, in the treatment of schizophrenia. To make it very simple, schizophrenia is thought to be the result of a too low rate of dopamine in the mesocortical bundle and of a too high rate of dopamine in the mesolimbic bundle, respectively creating negative and positive symptoms. It is so hard to treat schizophrenia because beyond the cognitive symptoms, we will need to decrease the rate of dopamine in the mesolimbic bundle to avoid positive symptoms like hallucinations or delusions, and at the same time we will need to increase the rate of dopamine in the mesocortical bundle to avoid negative symptoms like social withdrawal or flat affect. Dopamine is a neurotransmitter. There are 4 dopaminergic bundles in the brain: the mesolimbic, the mesocortical, the nigrostriatal, which is related to motor functions, and the tuberoinfundibular. The release of dopamine in the tuberoinfundibular bundle inhibits the release of certain hormones like prolactin. A dopaminergic bundle is actually a pathway which has to transmit dopamine from an area in the brain to another area. Typical antipsychotics like Hadol or Furazine were found in the 50s. They actually block the dopaminergic receptors, decreasing the rate of dopamine in the brain, notably in the mesolimbic bundle, this way avoiding positive symptoms, most of the positive symptoms seen in schizophrenia for most patients. But the problem is that antipsychotics do not act selectively, meaning that they do not target the mesolimbic bundle. As a result, typical antipsychotics will also decrease the rate of dopamine in the 3 other bundles, creating the well-known side effects and very disturbing side effects of typical antipsychotics. First of all, the decrease of dopamine in the mesocortical bundle will worsen the negative symptoms. This is what we refer to as the antiproductive side effect of antipsychotics, meaning that if a psychiatrist treats a schizophrenic patient with a high dose of a typical antipsychotic, well, the patient may not be able to function very well or to function at all. Secondly, the decrease of dopamine in the nigrostriatal bundle is very likely to result as motor dysfunction. I may repeat this. More than 80% of D2 striatal blockage will result in extrapyramidal symptoms like, but not limited to, Parkinsonism and akathisia. Finally, the decrease of the rate of dopamine in the tuberoinfundibular bundle will inhibit the inhibition of the release of prolactin, creating a too high rate of prolactin in the blood, known as hyperprolactinemia, which will cause for most patients sexual dysfunctions. A typical antipsychotics like Risperdal or Deprexa, which were found in the 90s, except clozaril, have less side effects. But why? Actually, by definition, they also block some serotoninergic receptors, notably the 5-HT2A receptors. Serotonin is another neurotransmitter. We know that the postsynaptic blockage of these receptors in the dopaminergic bundles increases the release of dopamine. As a result, in the mesocortical bundle, the rate of dopamine increases, and at least it doesn't worsen the negative symptoms, except for some neuroleptics if we use high doses. I'm thinking of Risperdal, for instance, but most of the time they do not make the negative symptoms worse and may even help with the negative symptoms. I'm thinking of aripiprazole, Abilify. Then, the release of dopamine in the tuberoinfundibular and the nigrostriatal bundles has the effect of most of the time, once again, inhibit the previous side effects I was talking about. But once again, it depends on the antipsychotics you're taking. If you have any question about this, you should ask your psychiatrist, because he is the one you have to refer to if you have any question about your treatment. I am not a medical doctor yet, and even if I was a medical doctor, I wouldn't be able to give you advice through the internet. What I'm doing here is just trying to help people understand very simply how it works in the brain. Okay, this was Mental Health Student 22. Thank you.